Well, in fact, the amount of patients we operate has reduced a lot during last, I would say, 10 or 15 years. Because as I told you before, and maybe you know, the neonatal intensive care unit we have works real good. So as there come children with necrotizing enterocolitis, anytime we need to operate less of them. These cases are not very common. Hopefully, that's what we want, and we don't have many. But as we know, the problems of short bowel syndrome, because as I explained, we operate them and we suffer with them and their families. Well, we are very interested, all of us, because we work all together in not getting to there, to be able to avoid this condition. And then Dr. Carmen Belloc, which is my chief, started with this technique. The results were what you saw. We have other patients, but I only exposed one because I thought it was enough. And then when you have something that works really well, where others don't, well, we thought it was interesting for it to be known.
Thank you. I think that the article is quite ready for
What?
your colleague. Your article is quite ready.
Yes, we share the work. So Dr. Benyoc, Dr. Carmen Benyoc is getting the last point of it.
Okay, there is
You will soon have it.
There is no problem up to September. If you have some problem of work and of delay, there is no problem to September.
Thanks so much. We'll be very honored to have it with you.
Thank you very much for your presentation.
Thank you. I want to thank Dr. Brines for this opportunity, because for us, he's, as Dr. Seki said before, our science model. We will not arrive to that, but we try. So it's better to have a higher model to get farther.
Yes, I thank again Professor Brines, who have prepared so brilliant team in Valencia University Hospital. And thank you for your English. It's very fluent English, and it's very, very, very well. Thank you very much.
Thanks so much.
Thank you, Anna. Thank you, Claude. I like to add, thank you, Anna. Thank you, Claude. I like to ask something about the career of our pediatric surgeons. This is the creation of the service of the pediatric surgery service in the hospital clinic. I think is the main achievement in my professional life. As most who care children knows, the care of the children in a third level hospital stand up in the shoulders of pediatrician, of pediatric surgeon, and the nursery. So the creation of a service independent of pediatric service, but with the same in the same building with the same bed and so on, has been, in my opinion, a real success. I must add that during 2 decades, the burden of surgery, of child surgery in our hospital has been on the shoulders of Carmen Belloc and Ana Lopez. And I think no words enough to for the depth we have with the important quality and quantity work. And with this, as you probably know, neonatal enterocolitis is one of the most important causes of mortality in premature infant. So in neonatal enterocolitis is the usual approach to surgical approach to them is to do extreme activity. That is remove all the intestine. That this practice drive immediately to enteral nutrition for life, with because the enteral transplantation has a very bad outcome. The necrosis. This pediatric surgeon, Carmen and Anna, saw that the necrosis of the intestine of the premature was patched. That is the tree-like arborization, the tree-like vascularization of intestine was collapsed in the course of the shock neonatal, in the premature neonatal shock and so on. Some of these branch continue to go blood to the intestine. Obviously, the reconstruction of the removal of died intestine, the keeping alive the intestine, which is sane, is very difficult. The stomias to the abdomen wall is difficult. This is a very difficult and large and prolonged therapy. But the results is, when it is possible, the results are extraordinary. I can assure you that in several cases has been very surprised for the good results, because the prospective capacity to develop the two sections, the two ends of the loop section is extraordinary. We have been able to show that with 20-50 centimeters of intestine can enlarge to half a meter and so on. Congratulations for your work, Anna. Congratulations for this presentation. Thank you very much indeed, Claude, for make easier the publication, also the article of Ana Lopez, the Carmen Belloc, and the article of Jose Miseki. Thank you very much indeed.
Thank you.
Thank you. I have to thank Gillian. Where is Gillian?
Okay.
Because his president has facilitated this day, and his presence is also magic.
Yes, it is.
Suscite enthusiasm.
Yes.
And I hope that you can add future presentation, future congress, and in November, the 10th and the 11th of November, there is a new congress, but I hope in presential congress in Paris. And I don't know what do you present in Paris, and what's the money to present in Paris, but I thank also Alice and Krishna and all the Confrontier team who help us very, very important. And I don't know Nafis, but she's very efficiency, and Krishna is very, 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 very good, and always very smiling people who who uh, who calm the quiet, who quiet the anxiety of the presenter, of the speaker, and I am very happy to begin at the good hour and to finish in advance. I thank you very much. If some people from the first and 2 day are invited to continue to listen the session for tomorrow and maybe Saturday, but it's very difficult with a busy doctor to have a 4 day to be present in a virtual conference. Thank you very much.
Thank you.
And maybe Gillian, if she's here, say the final word.
Okay.
Well, I'm very
Okay,
happy.
Gillian.
I'm very happy to, but I don't have anything prepared other than to say, you know, as always, it's been fascinating. There's such a wide range of specialties presented here. And it's very interesting for me, and I'm sure it is for everybody here, to have this opportunity to be able to learn from so many experts, mainly from France and Spain and so on, but elsewhere as well. There's definitely a presentation tomorrow that I shall be tuning in for to do with the medications and breast milk. So I'll look forward to that. But thank you, Claude, as always, and Professor Breen, Juan. I sent you a message. I don't know if you saw it. And to all you excellent speakers, and for all the amazing work that's happening. I certainly learned a lot. I enjoyed it. So thank you.
Thank you.
Thank you, Gillian. Thank you.
Thank
Thank
you.
you.
Thank you, Gillian.
Thank you, Dr. Claude. Thank you, Dr. John Bryan. Thank you, Jillian, for all the time. You had been a great support to the conference.
Thank you all time. Thank you to Alice, which is not present
Yeah.
in the face, but she organized in behind the people who act by phone to say, "Hi, Claude, Anna is not here." It's very sympathetic. The efficiency also to organize and to make the program, to make that all will be in the time. And thank you to her and to all the team of Confrontier. Thank you very much.